Hello everyone, welcome to Digital Health News, where we delve into the cutting edge innovation shaping healthcare and the critical conversations surrounding them. Today, we are diving into one of the most transformative yet complex topics of our time: AI in healthcare, its incredible potential, and the caution we must exercise in its application. To guide us through this fascinating subject, we have the privilege of hosting Dr. Sushil Kumar Meher, the Chief Information Officer of AIIMS New Delhi, a pioneer in leveraging technology to redefine healthcare delivery in India. With over 3 decades of experience, Dr. Meher has been instrumental in driving digital transformation at AIIMS, blending cutting edge technology with patient centered care. From implementing AI enabled electronics medical record to championing telemedicine, his work has placed AIIMS at the forefront of healthcare innovation. And yet, Dr. Meher is also a thoughtful advocate for balancing innovation with caution and for responsible AI. In a world where AI can enhance diagnostics, streamline operations, and personalize patient care, he reminds us of the ethical, practical, and security challenges that must not be overlooked. Join us as we explore the promises and pitfalls of AI in healthcare, the lessons learned from real world implementations, and the critical safeguards we must adopt to ensure technology remains a tool for good. Dr. Sushil Kumar Meher, welcome to the podcast. Let me ask my first question. I guess about a year ago, around the same time, we connected for another podcast on DHN, where you had spoken about ABBA Scan and Share and its success in AIIMS New Delhi. But in the past 1 year, we have seen a lot of buzz around artificial intelligence. AIIMS itself has made remarkable progress in AI and digital health over the past year. Can you start by sharing what prompted this drive towards AI integration at AIIMS New Delhi and what opportunities you see for AI in transforming Indian healthcare?
Yeah, today's days, if we talk about any transformation in healthcare, without AI, it is just impossible. Okay. And earlier, many places I have already spoken, AIMS is very prone to the technology. They adopt the technology very early and fast. But you have to understand that healthcare is a very complex and a very critical domains where if we intervene any technology, it's supposed to be tested properly and the regulatory what it is being required to follow it. Okay. Now you have asked me the AI use of AI in the Premier Institute AIMS. They have already adopted a few years back. Okay. And many AI products which is being used here, but maximum the AI which is being developed in homegrown models. Okay, we have one product is developed for the early forecasting of infection to the neonatal baby in our neonatal ward. It has been used. That is also in house. Another one is that iOncology.ai, which is be a project based we have used, and that is initially it was a national project. Right now it is going to be international project. So when the MOU will be signed with few countries, this product will be used in many countries. And already we are in a discussion with the ministry as well as the stakeholder of the some countries, and they shown the inclination to use iOncology.ai in their country. But before that, the MOU has to be signed. After that, we'll find the how to implement it. Another applications which has already been there. See, what I have remembered, it is about to be uh, 8 years back. Okay, we want to know that what type of patient is coming to the AIMS hospital in which seasons, because diseases vary from season to season. Okay, and we have taken the help of Indian Statistical Institute, and we have done a regression analysis and all these things, and we have seen the pattern of the patients, which has been changing from season to season and years to year. Based on that, we can visualize the which type of patients are coming in which season and what kind of infra is supposed to be in place.
Hmm.
So that is already been done means about 8 years back. Right now, lot of things it is on AI. Your radiology is on AI. Your lab is on AI. Your patients forecasting, then your patients clinical systems, all are on AI based, but hardly use any product which is being commercially available in the market. Maximum we are using in-house developed or any research project more, which is been come here. Then we are doing it.
Thank you. Thank you so much, sir, for giving us this detailed explanation about the initiatives in terms of artificial intelligence at AIIMS. But I would like to ask you, what is your overall artificial intelligence vision and what is the AI roadmap for AIIMS New Delhi now?
So first of all, you have to understand whether AI uh, is it a time to use the AI in healthcare? You have to look into that angle because many things it has not been in place. Okay, the people have already been dreamed that AI is supposed to be implemented in healthcare.
Hmm.
I have few questions. You have to understand, and many places people they forgo it, and it is very dangerous in all the domains. But in healthcare domains, you can't compromise it.
Right.
First of all, first of all, when you go for any AI model, let's take where one model is available commercially and you are using it. Can I know that this model is developed in which mathematical models?
Hmm.
We don't know. It is a black box for a user.
Hmm.
Who is claiming it? The product developer is claiming it. Is it being approved by any independent agency? No. Okay. Then if you want that product to test it, I have to use few sample data and I'll test it. It is not possible to hold data which I have to test it. And the product is which is being developed and which is being trained by the machine learning ML or LLM. In that cases, can the vendor will share that these are the types of data which they have used for develop they have trained the model? That is also not possible
Hmm.
because your regulator is not allowing it that you can't share the data to others.
Hmm.
There is no regulatory to test the model. Okay, only vendor is claiming.
Hmm.
Okay, and you know it that each and every AI model the data is going, some kind of biasness is there.
Right.
Okay, some kind of biasness is there. What is that biasness? What is the percentage of biasness?
Hmm.
Sometimes we are using the data, we unknowingly you are using it. So when you use it, let's take one model is claiming that it is my model is it is 92% of
Hmm.
accuracy. Okay, let's take if they have choose their data, they have built up the model, but here I have not choose the data. Whatever data is, I have to use it.
Correct.
You got my point. So my data may be a junk for that model.
Hmm.
When my data is junk for the model, when the data which is going inside, it is a garbage in and it will go garbage out.
Hmm.
So the expectation from the model, the 92% will degrade day by day
Hmm.
because you are not giving the data which is the model is required.
Hmm.
Because the model has been already been trained some other kind of data. I am putting some other kind of data, which is not matching.
Understood. Right.
This is the main challenge in the industry. People do not understand. They are using blindly the model and using it. Second question is that, is there any method which model you are using and you are satisfied? But what is it the model is performing and improving well or not? Or it is going downgrading? That testing also we do not have. So there is no system is available to somebody will certify that this model is accurate for you, and this model in future also it will give the improvement when you put the data.
Right.
So these are the major challenges in the AI when you use in any domains. In healthcare, more challenges because healthcare is a very life threatening. If you dependent on the AI and it will give a some kind of result, it will harm to the patient, then who will be responsible for it? That's why people
Absolutely.
are talking about responsible AI.
I understand your point, and I think you made a very important point here. You absolutely hit the nail when you talked about responsible artificial intelligence in healthcare. Now, in general, when we talk about AI in healthcare, you see two kind of people. One who are very optimistic about the use of AI, and one who are very cautious about use of AI. I would not say that pessimistic, but I would say they are very cautious about the use of artificial intelligence. You see, world over, in US, in Europe, in India also, we have seen a lot of development with regards to AI in healthcare. But do you think, from your cautious perspective, that the maturity that artificial intelligence needs to hit, where it becomes a very regular thing in healthcare operations, in day-to-day healthcare operations, we are yet to reach there?
See, every technology has a maturity model.
Hmm.
In AI, already I have told you that there is no independent agency who will test your model, which can certify your model. Okay, so the maturity model is far away from us. Okay, first part is that who can use it, where to be use it. There is few countries already they have a AI law is already enforced or going to be enforced.
Right.
Okay, and if somebody, I recommend everybody, those who are listening to me, please read the European Union AI Act. Lot of things it is given there. And there it is mentioned where you have to use AI and where not to use AI. This is the beauty of that. But in healthcare, it is similar to that. If you want to use AI, is a assistive rule, assistive instrument to the healthcare workers it's supposed to be. It should not be that totally dependent on that model. Let's take one example I'm giving to you. It is a tertiary care hospital, but you use primary care, secondary care, all the things. It has been allowed. If you have an AI bot, okay, as a super specialty, there's a lot of specialties there. People confused to go to the which specialty they have to show it. So many people they landed in a wrong department. When they landed in the wrong department, means whole day is spoiled. Doctor's time is spoiled. If you do some AI tools to screening the patient, let's say we are around more than 30% patients are landing in a wrong department. That's one example I'm giving. If you can reduce to 7 to 8 to 10% means that much of percentage of patients they have landed in a right department.
Correct.
So patient time has saved, doctor's time has been saved, and there is no risk on it. So in that case, it is a very huge cases. People can start using it, This is one thing. Another part is that when you use, let's say, we have a lot of shortage of radiologists.
Hmm.
Okay. And if you talk about a whole body scanning of CT scan, let's take whole body CT scan, it is more than a 1,000 uh, images which is being stored. And each image it is very difficult to scan by the doctor. If AI models, today's days it takes 3 to 4 days to make a report.
Hmm.
Each each patient's CT scan, at least it is taking on average half an hour to 40 minutes.
Right.
If we use AI, let's take AI, make the reports, and doctors re-verify it,
Hmm.
because medical images, digital images, it has gone far ahead because the resolution has very high standard, the quality of image is very high standard due to the resolutions and all these things. So in that cases, what it happens, if you take pixel by pixel, your ML will give a good quality of report. And again, it will be verified by the doctors.
Hmm.
Means that 40 minutes can be reduced to 15 to 10 minutes. So doctors can give more, can prepare more reports on radiology.
Hmm.
So this is the one of the good things it is. Second one is that people have started using it. That is pathology imaging.
Hmm.
Pathology is a very legal reports. It is very critical reports because majority of the pathology reports is meant for the detecting the cancer, and that's why many hospitals they re-verify other hospital or other laboratory services people what they have reported it and see the slides and reconfirming it, because
Hmm.
of sometimes it may be missed by the doctor unknowingly. So if this pathology image can be put in AI and he can detect, so the accuracy rate will go up and quality of reports definitely much better as compared to the manual reporting.
Hmm.
So these are the huge area which you can say. Just I have told you the prediction, early prediction of the newborn baby, whether
Hmm.
the newborn baby is infected and when will be infected and what kind of infection to be. So if doctors know that, they will prepare accordingly. That okay, these are the things they're supposed to check and go through it. So these are the few things. What my suggestions is that you look into it. That where you have to use the AI
Hmm.
and what kind of AI is supposed to be, but the models it's supposed to be properly tested and do slowly. The acceptance levels what you have asked me, who are ready to use it, who are very cautiously using it.
Hmm.
See, it is a technology, it is a new technology. People have started using it, but the problem is that if the seniors doctors they feel that without manual intervention, the AI is nothing.
Hmm.
Okay, the data which is coming from your wearable device, the data which is coming from the bypatches, that is do not give a accuracy level of the patients. So what kind of data? If the doctors do not see real time, they do not have the confidence to give a consultations.
Hmm.
See, you have a digital stethoscope. You have a digital BP measuring machines. It is not that much of accurate as compared to the manuals. So doctors more prefer the manual system to that.
Hmm.
If this data will come up, in that cases, it is a very difficult for the doctor to take a call on it.
Hmm.
So these are the some barriers are there, but if we give a assistive tool, just like CDSS,
Hmm.
clinical decision support system, if AI based is there, what it happens? The patient is, let's say, getting treatment last 6 to 8 years. Huge medical record is there. So it is a AI guided clinical decision system.
Hmm.
So he can read the past data very fast. He can communicate to the doctors that when you are prescribing these medicines, this medicine is allergic to the patient, already been diagnosed in that
Hmm.
way. Okay, which so many voluminous data, doctors is very difficult to go through it each and everything. Already AI played the role. He
Hmm.
has a hypertension. He has a diabetics. So it's small things. It has been detected very early,
Right.
but it is not coming from the doctor's front page what he's doing it. So if these things are coming up, doctors can look at, oh, his diabetes, I have to give this kind of medicine, not this kind of
Yes.
medicine. This type of salt, it is reactive to the patient, so I have to choose this kind of salt.
Hmm.
So these are the things it can help. And another thing it can do, he can read multiple parameters. He can suggest okay, what kind of further test can be done.
Yes.
Okay, so it will take faster to take the decision by the doctor. So these are the things which can be used and doctors to be make the more awareness, more training programs, more understanding. But two things are there. Young doctors very first to change their mind to take the technology than the
Hmm.
old age doctors. That is the main means bottlenecks when you use the any technology. Yeah.
Absolutely. You just mentioned the my next question point. How has been change management at AIIMS when especially implementing new technologies like artificial intelligence? Like you mentioned, senior doctors, senior staff, they are more resistive towards a change in technology. They are very used to their old ways of doing things. And when you introduce a new technology in a healthcare institution like AIIMS, how is the response and how do you make that shift happen towards newer technology?
See, there is a lot of technologies out there in healthcare. Everything is coming up. If we
Yes.
talk about today's, that the mobile phone is saturated
Hmm.
with features. Only features is it is going to be go up. It will come up. It is healthcare related. Okay, so right now the Apple as well as the Android peoples, they are working in different healthcare apps to go for it. So definitely technology putting a bigger role. Already I have told you, bypatches has come up. Whole body
Yes.
is whole, different parts of the body, different bypatches are coming out, even for eye, for ear,
Hmm.
for nose, your foreheads also. Okay, so all the parameters is catching very fast right now, and data is aggregating very fast.
Hmm.
Okay, but these devices are not properly tested, or it is not being properly
Hmm.
scrutinized by the some of the agencies. Okay,
Hmm.
they claim themselves. So these are the challenges are there. But right now, three or four things are very largely people are using it. One is the IOMT devices.
Yes.
Okay, okay, IOMT devices. Another one is the AR VR. People are using it. Artificial, sorry, um, that is the virtual reality and augmented reality. Third one is the people are using it that AI already we are discussing this one. Third one is that people are using blockchains.
Hmm.
Okay, because right now cybersecurity is and transparency to maintain the medical records and all these things, people have started blockchains for ease because all the insurance people they want that is supposed to be a secure and unaltered data to them. Okay, so
Hmm.
blockchains is one of the main advantage to them for to get a accurate data to the agencies. Fourth one is that people now going virtual. Okay, and that is started. It is accepted by the patient as well as the doctors. Many solution is in the market also. Let's take one person is discharged, but he has it required to continuously monitor.
Hmm.
Okay, so they are taking that service from the patients. Patient is there at home, real time parameters is observed by the hospital doctor there,
Hmm.
and they have posted a paramedical staff there, so locally he can handle it.
Hmm.
This kind of things is coming up in the market. Even people have started using mini ICU at home
Hmm. Hmm.
because hospitals are more infectious. Centralized air conditions are there. Lot of virus are there which will be infected to the patients those who are admitted in the ICUs. So it is better to people are going towards the home ICU. That is also come up. Third thing is that if you talk about mobile health, sorry, ambulance healthcare.
Hmm.
Okay. So right now we are also working on that. There is some projects we are going to do it that one. If the patient is being traveling through the ambulance, we want to capture the vital parameters remotely, so we can understand what is the condition of the patient.
Hmm.
When patient will reach at that time, the facilities available to the patients, and the medical staffs are supposed to, which is required to be there, they will be available, so that we can save the time and save the patient life. So right now people are working real
Hmm.
times. Yeah, because communication is so easier because 5G has come up.
Yes.
Communication of the 5G, people are taking the advantage of that. So this kind of things which is required, and right now Delhi government is also working on it. That the ambulance service is supposed to be high tech, so that
Hmm.
remote operate can be easily.
Dr. Meher, you just mentioned about all these technologies, be it 5G enabled ambulances, be it IoMT devices, be it patches. You see, a lot of people today are also fitness conscious. They use several smart wearable devices which capture their sleep timings, their food intakes, their glucose monitoring, and all this data is being accumulated on these devices, which are also sort of useful for a hospital setting in disease management. But how do we secure all this data? What are the parameters, do you say, that are required to secure this data and protect the identity and security of the patient?
See, after the COVID, it has been seen that some of the agency they have already informed that the attack has been increased 72% in healthcare,
Yes.
and it is quite huge. And
Hmm.
right now, many agencies they speak. It is not the manufacturing or or finance or banking or insurance. The number one vulnerability is that is the
Hmm.
healthcare, and it is a big challenge for that because healthcare it is such a domain. It comes from your heart. Okay,
Yes.
some patient is suffering, and you want to share the data to different people to get a quality of treatment. You share it very easily.
Hmm.
Okay, but there is some regularity supposed to be in place. First of all, EMR standard has already mentioned that what is the security, confidentiality, and privacy of the
Hmm.
patient records. It is already been mentioned, and what standard has to be followed, ISO standard has to be followed. It has already been in place, but it is not sufficient to do it. There is a lot of things which has to be in regularity. It has come up.
Hmm.
So one act it has come in 2018. It is called DISA.
Hmm.
Okay, digital health security patient security system DISA, but it has not been approved yet. because at that time personal data protection bill was not been approved. So some of this which is required from personal data protection bills to incorporate in the DISA. So that's why what I feel they do not proceed. Right now, personal data protection bills, it has been named as DPDP.
Yes.
Yeah, when DPDP will be enforced, after that, definitely I feel DISA will play a role because there is some modification is required, which is being done by the DISA in DISA, and people started using it. Okay. Second part is that your your records is very vulnerable, that has to be protected, and hospitals are very fast right now go for digital transformation in the hospital. So they do not take care of the security part at the beginning. Security by design, that is supposed to be there at first, but they do not look after the security. When the things will completed, then they'll think for the security. In that case, the challenges are there. But my suggestion is that when we talk about cyber security, you have a lot of different messages connected with IoT devices. And in healthcare, IoT playing, it is just like tsunami for the organizations that. So whatever is required, okay, put it IoT device and connect it, capture the data. Once it is there, okay, put a IoT devices and connect it and capture the data and store in the central database. So these are the points. Today's it is very vulnerable. I have many attacks is coming through IoT devices. And last few months we have observed that the supply chain area, you are connected with different vendors, different suppliers. From there, the attack is coming very fast. So you have to be more careful on this. But my suggestion is two things are there. Okay, one thing is that try to protect yourself, whatever it is, at your endpoint. Okay, because any solutions in the industry which is being implemented, it is not 100% to be protected. Nobody give you the 100% protections. So there is a vulnerability is there. There is someone who will attack to you. So you supposed to have a resilient programs, that is business continuity and disaster recovery programs in place. If something is happening, how fast it will come to the on your business? That is, you have to take a call on it because your business, what way it is working. Okay, you want 10 minutes to recover or you want 2 days to recover. Depends on this. You have to place the technology so that you can recover fast. So right now, not in the healthcare, major organizations, they are working very hard on resilient programs. Something will happen, my system is placed, they can take over it, and I'll be in business as per my requirements. Second part is that your whenever you go for a organization from cyber security programs, people they go for a product. Okay, vendors will come, they'll show you a product. These are the products, these are the features are there. You take it, it will help you to protect yourself. But first of all, you have to study your environment, your systems, your infrastructure. What I mean to, what I want to say. First of all, you study the systems. Where is the vulnerability is there? Okay, you purchase a product, it may not help you out because that is not your requirements. There's hundreds of products are there. Everything you can't purchase it, and everything is not your requirement. So you have to do the proper assessment.
Right.
proper assessment of your infra and applications, your process. There is three things are there: PPT, people, process, technology.
Hmm.
Everything has to be done through that. And
Absolutely.
after that, you take a call what kind of solution is required. And another thing is that you have to understand, cyber security is not a one, one point of solution. Cyber security is a ongoing process, never end. And if you will sleep in one solutions, you gone, because it is evolving so fast. The hackers are evolving, need technology is so fast, you can't survive. So
Hmm.
every minute you are a vulnerable, and you have to take in your mind whatever you have solution it is in place. Don't be overconfident. Don't be overconfident. You have to understand this is not the 100%, so that when the attack will come and how to react for that. Okay,
Absolutely.
when the attack will come and how I have to react for that. For this, you have to do continuous simulation programs,
Hmm.
mock drill, mock drill, so that the confidence level will come up. Third thing is that cybersecurity is not a CISO's rule. It is a part of the CISO's rules, but
Hmm.
who is every people those who are involved in the IT departments, even management also, they are also part of that. And
Right.
cybersecurity is a issue of organizations.
Hmm.
So this is my opinions on healthcare security systems. Yeah.
Absolutely. Thank you. Thank you so much for all this detailed information, sir. I believe there has been a lot of influx of very positive information towards artificial intelligence. And obviously, nobody is denying the use of artificial intelligence in healthcare and also all these technologies. But like you rightly mentioned, we also have to have a cautious approach, and we should also find a responsible AI in healthcare. We should all strive towards it. Thank you so much. Thank you so much for this conversation. Have a great day, sir.
Okay, thank you.